Hello and welcome back, ladies and gentlemen. We are live on ESI TV here at ESICON 2018, the 48th Annual Conference of Endocrine Society of India. And live with us, we have Dr. Vinod Mittal with us. He is a Senior Consultant Diabetologist and Head at Center for Metabolic Diseases, Delhi Heart and Lung Institute. He's also the Director for Delhi Diabetes Care Center. So welcome, sir, here on board with us. We're so glad you've joined in and agreed for this live feed. And such an interesting academic initiative that here at ESICON 2018 we are talking about. So talking about the journey, the evolution of endocrinology and your experience here with us at ESICON 2018, a quick overview about this academic feast.
ESICON 2018 is a great conference, and here all endocrinologists across India and international faculty is there, and there is a discussion, very active interaction going on for different topics in endocrinology, and especially diabetes and other diseases, thyroid disorders. So it's really a great scientific feast which is going to help almost all endocrinologists of the country, as well as all physicians and diabetologists and other postgraduate students.
Certainly, sir, having mentioned that this year for the very first time new initiatives and ideologies and concepts have been introduced, talking about EPL. Yesterday was the Panchayat Day, and today again we'll be joining in to panel discussion. And sir, I hear that you're sharing for 4 sessions. Let's have a deep, detailed conversation with 2 of your topics. First being heart failure and diabetes. So could you please let us know in depth what do we look forward from this panel discussion, the severity of the problem, how it needs to be addressed for our audience, please.
Heart failure in diabetes is very common. It is basically a silent killer. In type 2 diabetes patient, almost 70% of diabetic patients, they die of heart diseases, and most of these patients, they die of heart failure, which remains silent and we are not diagnosing it. Diastolic dysfunction is the first abnormality which happens in the natural history of heart failure, and that is diagnosed only on the basis of some laboratory biomarkers like NT-proBNP, as well as on echocardiography. After 3 to 5 years of diagnosis of diabetes, almost all the patients, they have some diastolic dysfunction, and at this stage we should address and give treatment for diastolic dysfunction. And today we have some agents. Besides we have one group of agents like ARNI, but we have SGLT2 inhibitors which have been launched world over in last 3 years, and these molecules have done wonder. So they are very, very helpful in these patients. So basically all type 2 diabetic patients, after the diagnosis, after 5 years of diagnosis, patients should be screened for diastolic dysfunction, and we should take measures accordingly.
Sure, sir. Just some time ago, we had our senior faculty member. He did also mention about a session that he'd be talking about is DPP4 inhibitors and SGL2 inhibitors, or the combination. So this is something that our audience are really there for. They are looking forward to today's session in a very interesting way. All the presentations. One more to go in the list is diabetes and kidney diseases. That would you like to put some light on?
Yeah. So first, I'll just give a remark on this DPP4 combination with SGLT2. It's really a novel combination, and in India we have one combination available with us, which is empagliflozin with their own molecule linagliptin. So SGLT2 inhibitors take care of hospitalization due to heart failure, and DPP4 inhibitors, they are very, very cardiovascular safe. So it's basically a synergistic combination which is there, and I think we should be using this molecule, the combination, very early in the stage of diabetes. Now coming back to the diabetic kidney disease, again take my words, I've seen so many patients. Kidney disease in diabetes is again silent. It is asymptomatic in the initial stages. So we have to diagnose by doing UACR, it's urine albumin creatinine ratio. Once we start doing UACR in all the patients who are diagnosed for the first time with type 2 diabetes, there would be around 40 to 50% of patients who will have abnormal USCR, which will remain neglected, because what practically happening in India is, or even across the world, that we diagnose kidney disease only when serum creatinine is high. That is too late a stage.
Yes.
So basically the message conveyed should be that all type 2 diabetic patients, when they are diagnosed of diabetes, they should be screened for UACR, and depending on that we should take measures to control or prevent this diabetes. And there again we have very good agents which have shown good results in preventing or in fact decreasing the progression of renal disease are DPP-4 inhibitors, GLP-1 analogs and SGLT2 inhibitors.
Sure, sir. I'm sure the clinical guidelines, how about to go about it, is something that everybody would look forward to from the panel discussion and all the sessions. Well, thank you so much, doctor, for coming on board with us, going live with us on ESI TV. How do you like this entire concept? How does it come as an experience
it's a
to
very
you?
good, it's a very good concept, and by this, like it's a kind of a consensus. Now my opinion is there, other doctors' opinion is there, and our viewers,
Yes.
a lot of doctors are there in that. So they can, like get a lot of benefit from this. And definitely if there are any still queries left, they can always talk to us directly on phone or through on our email.
Sure,
So
absolutely.
it's really great, talking to you and, giving my views on heart failure in diabetes and diabetic kidney disease.
So it is indeed our pleasure. Thank you so much, Dr. Mittal, for joining in with us. And ladies and gentlemen, stay tuned for more updates, opinions, news and clinical developments from scientific program here at ESICON 2018. Thank you.